Welcome back to TV5 News at 9. It's time now for Medical Moments with Covenant Healthcare. And joining us this morning is Stroke Program Administrator Tracy Sullivan. Tracy, thank you so much for being here this morning. How are you?
Great. Thank you so much for having me.
We love having you here, so thanks for joining us and calling in. So we are talking about signs and symptoms of strokes today. But first, tell us what a stroke is and who they really impact the most.
Well, the most common stroke that we see is called an ischemic stroke, and that's where there's a blockage of blood flow to the brain. Then we have another stroke called a hemorrhagic stroke, and that is a bleeding stroke. A blood vessel has actually ruptured in the brain. And then we have something called TIA, or transient ischemic attack. A lot of people know that as a mini stroke. So those are strokes that happen, and the symptoms go away usually in about 24 hours, but that's really a big warning sign. About 1 in 5 of those people will actually have a full stroke in about 90 days. So as far as who is impacted by that, stroke does not discriminate. Anyone can have a stroke. We see people in their 20s to their 50s. I think people think that it's an old people problem, but really we do see everyone, all different ages, that can have a stroke.
All right, good to know, and definitely important to know that the warning signs and symptoms can definitely come back. So thank you for sharing that. Can you remind us exactly what the signs and symptoms look like in a person?
Yeah, absolutely. So I'm sure a lot of people are aware of FAST. Here at Covenant, we like to use the acronym BFAST. That picks up a couple different areas in the brain that a lot of people don't know that they could be having a stroke by using those symptoms. So the B stands for balance. If someone is having a difficult time walking, if they're dizzy, that could be a sign of stroke. The E stands for eyes, so that's vision. If you've lost vision in one side or blurred vision, that could be a symptom of it. The F, of course, is face. So when you smile, if your smile is crooked, if one side of your face is drooping down, that's a sign. The A stands for arms. People can simply put their arms out if one side is drifting down. If there's weakness in one side or numbness and tingling, that applies to the legs too. That could be a sign. Typically it's one side versus the other, but those are also signs and symptoms. S stands for speech. If someone has slurred speech, they're having a difficult time getting their words out. If they just are talking nonsense, they're just not making any sense at all, that could be a sign of stroke, as well as T for time. So we say that time is brain. So it is very important to get to the hospital immediately if you're having any of those signs.
Yeah, absolutely. And what should someone do besides getting to a hospital immediately if they do recognize these signs in a loved one or even themselves? How can they be their best advocate?
The best thing to do is to call 911 immediately. They will get you to the nearest stroke center and will be able to take care of you there. We say time is brain because we do have some treatment options for people that are having stroke if they come to the hospital within a certain time frame. So 4.5 hours, we do have a medication that we can give that does make the outcome better for people that have strokes, possibly up to 30%.
Okay, so it kind of sounds like it's between, not between life and death, but at least a race against time in order to treat this, right?
Absolutely. It is imperative to get to the hospital immediately.
All right, very good to know. There are controllable and uncontrollable risk factors, Tracy, for a stroke. Can you tell us about those and what people can do to reduce the risk?
Yeah, so 80% of strokes can be prevented, we've found out. So it's very good to know what the controllable ones, what the ones that you can actually help yourself to not have a stroke and take care of. So the number one reason that we see people have strokes is they have high blood pressure. It's uncontrolled, whether they're not taking the medicine or they're not on the right medication. So making sure that your blood pressure is being controlled. That is a number one thing. Also, diabetes. Making sure that your blood sugars are in the right ranges and taking your medications, eating properly. Atrial fibrillation, that is, we see people having stroke with that. Again, taking your medication, your blood thinner. Diet, exercise, obesity can raise your risk factor for having a stroke. Smoking and drinking too much alcohol is another reason. And there's the uncontrollable risk factors. So if your parents had a stroke or grandparents, age is a factor. We know that after 55, your risk for stroke does double. And being a woman puts you at higher risk for stroke as well.
I did not know that. So, Tracy, I appreciate all the information that you brought us today. This is great information and timely as well. Can you tell us, is there anything else that we should know about stroke awareness or stroke signs and symptoms?
The most important thing is to know those signs. Remember that acronym BFAST. If you see anyone or you think that you're having a stroke yourself, it is so important to call 911 so they can get you to the place that you need to be so that you can have a better outcome.
Yes, absolutely. Tracy, thank you so much for being here with us this morning.
Thank you so much for having me.
Yes, it was great to have you. Very informative. Of course, if you would like any additional information at home on today's topic, just head over to the Hot Links page on our website, WNEN.com.